Hello, and welcome to CARE-Cincinnati's video series on navigating resources in Cincinnati. Today, we will be talking about accessing healthcare. First, let's learn how healthcare works in the United States. The United States uses a mixed system, which means that our healthcare is part funded publicly and part funded privately. Healthcare in the U.S. is very expensive, so most people have some form of health insurance to help cover costs. Most of your regular health care will come from your main doctor or primary care provider. This doctor will have access to most or all of your health care records and information and can help you make personalized health decisions. Unless you have an emergency health situation, you usually need to schedule an appointment to get medical care. Doctors' offices can get very busy, so don't be surprised if appointments need to be made months in advance. We'll next talk about some options if you're looking to get healthcare treatment. Ideally, the emergency room should only be used for emergency situations, which can include severe injury, unexplained difficulty breathing, seizures, and more. All patients have a right to get emergency health treatment, even if they are undocumented. At the emergency room, the wait times can be long. Emergency health teams will treat their patients in order of when they arrive and by order of urgency. However, these visits are among the most expensive. Urgent care helps treat situations that need to be seen soon, but are not necessarily emergency situations, which can include minor injuries, colds or the flu, abdominal pain, and more. These locations do not typically accept appointments, so they tend to have more open schedules for non-emergency yet urgent health situations. Federally qualified health centers are community-based health centers that are supported by government funds to help provide quality health care to underserved communities, regardless of patient financial status, citizenship, and sexual orientation. To access these centers, you will need to schedule an appointment ahead of time. Since these organizations are meant to fill gaps in healthcare, their teams tend to be more understanding of complications like lack of health insurance or immigration status. The primary care provider is the main doctor who you will see most often for things like vaccinations, standard health checkups, or less urgent health concerns. Community health centers can help you find a primary care provider.
How can you pay for medical treatments? American healthcare is covered in different ways. The government offers some programs to fund patient health care, such as Medicaid, which covers patients who live under a certain income level, Medicare, which covers people age 65 or over, and patients with certain disabilities, and CHIP, or the Children's Health Insurance Program, which helps cover eligible children's health expenses. There are strict eligibility requirements for each of these programs. The rest of healthcare funding is done through private insurance companies. For patients who are eligible to buy private insurance or receive it through their jobs, here is a basic explanation of how it works. The monthly premium is the main cost. It is the amount that the patient pays for their insurance every month. The deductible is the yearly amount that needs to be met before the insurance company can begin to cover your health costs. This deductible resets every year on January 1st. For example, if your deductible is $300, you need to pay a total of $300 worth of health treatments before your insurance plan will begin helping you pay for any further health costs. Undocumented immigrants are far more likely than any other U.S. residents to be uninsured, which creates barriers to healthcare. Even without insurance, undocumented immigrants can receive medical care at certain health facilities, and many of these locations charge on a sliding scale. Disclosing your immigration status is not required to receive care, but you may be asked about your status if you apply for insurance. You can say you do not wish to apply for insurance and decline to respond about your immigration status. Regardless of status, patients have a right to an interpreter when receiving medical treatment. Where can I get health care in Cincinnati? There are several hospitals in and around Cincinnati, including UC, TriHealth, Christ Hospital, and the VA. Cincinnati Children's Hospital is one of the best hospitals for children in the country. It is a good idea to learn what hospital is nearest to you in case of an emergency. There are also several community healthcare centers that work with patients who don't have health insurance, such as Crossroad Health Center. Crossroad provides a sliding fee scale for patients with no insurance. Good Samaritan has a free healthcare center. And Equitas Health provides care to the LGBTQ+ community, people living with HIV, and anyone left out of traditional healthcare systems. Thank you for watching, and please check out the links in the description below for additional resources.